This is me RJ here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 6 video of the oral mucous membrane, and in this video we will be discussing with the non-keratinized epithelium and the specialized mucosa. Okay, and the previous video we have discussed with the keratinized epithelium there. Okay, that is masticatory mucosa, hard palate and gingiva, and in this video we will be discussing with those topics, and in upcoming videos in part 7 video we will be trying to cover all the remaining topics of oral mucosa and we will complete this chapter. Okay, so okay, now without delaying much, now let's start our video. Okay, so non-keratinized epithelium have thick non-keratinized epithelium and thin lamina propria. Okay, so non-keratinized epithelium is thick there and thin lamina propria is present in the non-keratinized epithelium. Different zones of lining mucosa vary from one another in their structure of the submucosa. Okay, so submucosa is the thing. Okay, so that is being different in the different zones of the lining mucosa. After that, mucous membrane is movably attached to the deep structure and doesn't restrict to the movement. Okay, so the mucous membrane is movably attached. Okay, so it is not firmly attached to the periosteum as like that in the masticatory mucosa. Okay, so they were firmly attached to the periosteum. Okay, so they were not properly movable. Okay, so that was the masticatory mucosa, that was keratinized epithelium there, and this is a non-keratinized epithelium mucous membrane which is movably attached to the deep structure. After that, first of all, in this non-keratinized epithelium we will discuss with the lips and the cheeks. Okay, so in the lips and the cheeks, so stratified squamous epithelium is there, short irregular retiridges is there. Okay, so as it is non-keratinized epithelium, it is just for lining purpose. Okay, so it doesn't resist the masticatory forces, so the retiridges should be short here. Okay, short and irregular here. After that, dense connective tissue in the lamina propria. Okay, after that, some mucous layer connects the lamina propria to the thin fascia of the muscle, consist of the strands of the densely grouped collagen fibers. Okay, so some mucous layer, okay, connects the lamina propria, okay, to the fascia of the muscles. Okay, so the submucous layer is connecting the lamina propria to the muscular layer. Okay, so fascia of the muscles, but in the masticatory mucosa, okay, in the keratinized epithelium it was attached to the periosteum, to the bone. Okay, so here it is attached to the fascia of the muscle which and consist, okay, so the submucous layer consists of the strands of the densely grouped collagen fibers. Okay, so we have densely grouped collagen fibers here. After that, there is a loose connective tissue containing the fat cells and small mixed gland between these strands. Okay, so loose connective tissue containing the fat cells. Okay, so fat cells are also present in this connective tissue of this submucous layer, and also the small mixed gland are present in between those strands. Okay, so both the fat cells and the minor salivary glands are present in this submucous layer. After that, those strands of connective tissue limit the mobility of the mucous membrane. Okay, so those strands of the connective tissue, it limits the mobility of the mucous membrane. Okay, so as I have written here, okay, so they are movably attached. Okay, movably attached to the deep structure, so they can move, but there is a limit, okay, up to which they can move. So that limit is provided by the strands of the connective tissue that is connecting this lamina propria to the deep structure of the muscle, okay, which is present in this submucous layer. After that, submucosa of the lips, small salivary glands are present there, and orbicularis oris is the muscle important in this submucosa of the lip. Okay, similarly in the submucosa of the cheeks gland, okay, cheeks, the glands are larger and are usually between the bundles of the buccinator muscle here. Okay, so in the submucosa of the lips we have small salivary gland and it is related with the orbicularis oris muscle. Okay, and in the submucosa of the cheeks, okay, we have larger salivary gland and it is related with the buccinator muscle. After that, lateral to the corner of the mouth, often opposite to the molar, isolated sebaceous gland called phodesis spore can be seen in this lips and cheeks. Okay, so you can just remember this can be asked in a MCQ exam. Okay, so we have covered these lips and the cheeks. After that, vestibular fornix or the alveolar mucosa. Okay, so vestibular fornix means the space, okay, between the gingiva and the cheek. or the gingiva or the lip. Okay, so mucosa of the lips and the cheek reflect from the vestibular fornix to the alveolar mucosa. Okay, so alveolar mucosa is the mucosa above the mucogingival junction. I have discussed it properly in the previous video. Okay, so vestibular fornix is the portion from which, okay, from at which, okay, the mucosa of the lips and the cheek, they just reflect and form the mucosa of the alveolar mucus, alveolar bone, that is alveolar mucosa. Okay, after that, in the fornix, mucosa is loosely connected to the underlying structure, so the necessary movements of the lip and the cheeks are permitted. Okay, so it is easy to understand. After that, median and the lateral labial frenula are the folds of the mucous membrane containing the loose connective tissue. Okay, so median and the lateral labial frenula. Okay, so about this medial frenum, okay, lateral frenum, buccal frenum, lingual frenum, labial frenum. Okay, you have studied in the prosthodontics. Okay, so those frenulum, okay, are just the folds of the mucous membrane, okay, and containing the loose connective tissue there. After that, very less ridges are either it is absent in this vestibular fornix or the alveolar mucosa. Lamina propria have many capillary loops. Okay, after that, some mucosa contain minor salivary gland and it attaches the alveolar mucosa and the vestibular fornix to the periosteum. Okay, so those points are very easy to understand. Okay, so once you look those points, you will just remember all those points, and you can also make your concept. Okay, so in the non-keratinized epithelium, you can easily say that there is a small papillae. Okay, so less number of retices are there. Okay, similarly, lamina propria have capillary loops, they have loose connective tissue. Okay, so such thing you can just add in your text, okay, while writing in the exam. So those are the general things. After that, ventral surface of the tongue, so they are also thin non-keratinized epithelial lining is there, and lamina propria is thin, having the numerous short papillae. So same thing is here. After that, submucosa is thin and irregular with the abundant blood vessels. Okay, so submucosa, it is thin, okay, and it is irregular with the abundant blood vessels. Okay, after that, in the areas of the absence of the submucosa, mucosa is directly attached to the periosteum. Okay, okay, so those points are very easy to understand. This is the histological features of the ventral surface of the tongue. Now, in the floor of the oral cavity, okay, so there are also thin non-keratinized epithelium, short papillae, lamina propria have the rich blood supply, and in the submucosa, upper portion contains the loose connective tissue, and below there is a adipose tissue. Okay, so the upper portion of the submucosa contains the loose connective tissue there, and at the lower portion of the submucosa we have adipose tissue. Okay, so if you want to remember this point in this floor of the oral cavity, you can remember this, but also you can write generally. Okay, so you can just write if you forgot. Okay, so in the upper portion what is there and in the lower portion what is there. So if you get confused in this, then you can just simply write there is a presence of the loose connective tissue, adipose tissue in the submucosa. Okay, minor salivary glands are present there. Okay, so all those points will be correct here. Okay, so this is quite of the general topic. After that, soft palate, so they are also thin non-keratinized epithelium, lamina propria is thick there with lots of elastic fibers. After that, some mucosa, they are loose connective tissue, numerous minor salivary glands and taste bud are present here in the same mucosa. Okay, so those are the three major constituent. Okay, and this taste bud, okay, so this is very important to remember here. Okay, so about the taste bud, okay, so it is only present in the some mucosa of the soft palate. Okay, so you should remember this, and few papillae are present there. Okay, so in this non-keratinized epithelium, so we have covered this, so this is very easy to understand. So we just have to remember the some 2 to 3 general points. Okay, and we can add all those points in all those portions of the oral mucosa. Okay, so it is very easy to understand. After this, now we will study with the specialized mucosa, and in the specialized mucosa we can see the dorsal lingual mucosa. But first of all, I will show you the picture, then it will be good. So first of all, we just look at the pictures. Okay, so you can see the different pictures here. Okay, so this is a buccal mucosa. Okay, so, and this is non-keratinized, gingiva, hard palate, vermilion zone. Okay, so look this picture, I have shown this picture. So this is a picture of the non-keratinized epithelium, and it is general to the all those non-keratinizing epithelium. Okay, so either it is a floor of the mouth, the ventral surface of the tongue, alveolar mucosa, so it is similar in all those persons. So in this tissue, So in this histological section you can see that there is a stratum superficiale, stratum intermedium and stratum basal. Okay, so three different epithelial layers we have. Short ridges are there, and the papillary portion of the lamina propria is less there because the ridges are smaller there, and the lamina propria, reticular portion of the lamina propria is present here. After that we can see the vertical strands of the connective tissue. Okay, and in between those vertical strands we can see the submucosa containing the fat cells, salivary gland present in between those uh, strands of the connective tissue. Okay, so we can see here the histological section of the non-keratinizing epithelium. Okay, so it is easy to understand now. After that, now about this specialized mucosa, and this can be asked in your theory exams. Okay, so write about the specialized mucosa, so we should study this properly. So in specialized mucosa, it is a dorsal lingual mucosa. Superior surface of the tongue is rough and irregular. Okay, so superior surface of the tongue is the rough and it is irregular. V-shaped line separates the anterior part of the tongue from the posterior part. Okay, so I think you have studied about this. Okay, so if this is a tongue, okay, if this is a tongue, then we can see the V-shaped structure. Okay, so this is a V-shaped structure separating the anterior papillary portion from the posterior lymphoid portion. Okay, so in the posterior portion we have lymphoid tissue present there. Okay, we have tonsils, different kind of tonsils present in the posterior portion, and in the anterior portion we have the papillae. Okay, so those are the papillae. Okay, I will be discussing with this. So this is a V-shaped line separating the anterior part with that of the posterior part. And after that, in another point anteriorly, there is a numerous fine pointed cone shaped papillae that give it velvet like appearance. Okay, so it is same thing written here. Now we will discuss with the four different papillae, and I think you have discussed you have studied with those papillae in the digestive system too. Okay, in GI, and okay, we will discuss in this oral mucosa too. Okay, so firstly we will start with the filiform papillae. So they are hair or thread like projections. Okay, histologically cone shaped structure lined by the stratified squamous epithelium. Okay, so they are hair or thread like projection. Histologically, when we will see this filiform papillae, they appear the cone like shape. Okay, so they appear cone like. I will show you the picture. Now they are stratified squamous epithelium, so those points you should remember there. Thick keratin is there with the certain central core of the connective tissue supporting the blood vessel. Okay, and taste bud is absent here. Okay, so in this filiform papillae you just have to remember that. Okay, so this filiform papillae is mostly abundant. Okay, so they are present all over the tongue. Okay, so it is most abundant papillae of the tongue, and it is keratinized, and it doesn't contain the taste bud, and it is appearing like that of the hair or the thread. Histologically, when we will see this filiform papillae, it appears as a cone. Okay, containing the stratified squamous epithelium with the central core having the connective tissue and which is supporting the blood vessel inside it. Okay, so that is the filiform papillae. After that, circumvallate papillae. Okay, so circumvallate papillae, it is just anterior to the sulcus terminalis. Okay, so about this V line. Okay, so this V shaped line is called sulcus terminalis. Okay, okay, so this V shaped line is the sulcus terminalis, and at the center portion, okay, we can see the small circle. Okay, so if this is a V line, okay, so if this is a V shaped line, so at the central portion you can see the hole there. Okay, so that is called the foramen cecum. Okay, so it is a foramen cecum. Okay, so I think you know with this foramen cecum. Okay, you are clear with this foramen cecum and sulcus terminalis. After that, there are 10 to 12 in number. Okay, and superficial surface of those papillae is at the level of the surface of the tongue. Okay, so about the circumvallate papillae, just larger, they are just the larger papillae. Okay, which are just in front of those sulcus terminalis. Okay, so at this portion, so in this portion we can see the circumvallate papillae just anterior to the sulcus terminalis, and at the central portion we can see the hole there. Okay, and that is called the foramen cecum, and this circumvallate papillae, superficial surface of those papillae is at the level of the tongue. Okay, okay, after that, in the next one, V-shaped sulcus is present all around the papillae, separating them from the adjacent portion of the tongue. Okay, so I will show here, you know, one picture. Okay, so if this is a circumvallate papillae, okay, so this is a schematic picture. Okay, so around this, okay, you can see the V type of the sulcus present there. Okay, so just remember there is a sulcus adjacent to that of the circumvallate papillae. Okay, so in this sulcus there is a secretion, okay, of the content of the salivary gland, that is a von Ebner's gland. I will be discussing with that. Okay, so there is a V-shaped sulcus present all around the papillae, separating them from the adjacent portion of the tongue, and there is a keratinized stratified squamous epithelium at the superficial portion and non-keratinized at the lateral portion. Okay, so keratinized at the superficial portion, non-keratinized at the lateral portion. Here it was the keratinized stratified squamous epithelium, okay, both at the superficial and at the lateral portion, but here in the lateral portion we have non-keratinized. And in the taste bud, okay, so the taste bud are present in this lateral surface, okay, but it was absent in this filiform papillae. Okay, and the central portion contains the connective tissue. Okay, so it is also present here in filiform papillae. Serous minor salivary gland. Okay, so serous minor salivary gland. Okay, I think we are clear with this serous and mucus. So serous means quite of watery secretion is there. Okay, so von Ebner's gland is present there. Okay, that is a characteristic feature of the circumvallate papillae, and those salivary gland secretes the watery saliva to flush out the food debris in the V-shaped trough. Okay, so from the circumvallate papillae you just remember 2-3 points. Okay, then you can remember all those things that are present in this circumvallate papillae. So they are the most larger. Okay, so they are the bigger papillae present in the tongue. Okay, and the superficial portion, okay, it is just aligning with the surface of the tongue, and it have the keratinized stratified squamous epithelium, means it is keratinized at the superficial portion but it is non-keratinized at the lateral portion. I will be showing you picture. And the taste bud that is present at the lateral portion. Okay, and we have the von Ebner's gland present in this circumvallate papillae, which secretes the water secretion which flush out the food debris that is present in the V-shaped trough, which is just adjacent to the encircling the circumvallate papillae. Okay, so the things are clear here. Okay, after that, fungiform papillae. Okay, so they are fungus like, dome shaped, projecting above the surface of the tongue. Okay, so they are fungus like. Okay, so fungiform, so the name coming from the fungus like, and dome shaped, projecting above the surface of the tongue, and thin non-keratinized stratified squamous epithelium. Okay, so they are thin non-keratinized, and superficially taste bud are present here. Okay, but it was not present in the circumvallate papillae, they were present laterally. Okay, so you should just compare like that way and you can remember for the longer period. And supporting connective tissue shows the collagen fiber, fibroblast, and the blood vessel. Okay, so it is easy to understand about this fungiform papillae. And after that we have foliate papillae. Okay, so about this foliate papillae, it is not quite present in the tongue of the humans. Okay, but they are present in the rabbits. Okay, rabbit and the rats. Okay, so it is not present in the humans, but also sometime you can observe this foliate papillae. Okay, so taste bud are present in this foliate papillae and they are mostly present at the lateral margins of the tongue. Okay, so we have covered about this papillae, and I think you have studied this papillae in the GI also. So we have covered this. Now I will show you the picture of those papillae. Okay, so this is a filiform papillae. Okay, so you can see the spike like structure. Okay, so they are hair like, thread like, okay, and cone shaped. Okay, in histological section, so we can see the filiform papillae here, and they are keratinized all over the surface. Okay, so in the superficial part, in the lateral part, there is, we can see the thread like structure. They are the keratins there. Okay, so keratinized epithelium is there. Okay, so connective tissue core is there. Okay, so this is a connective tissue core, okay, containing the blood vessels. So those are the blood vessels there. Okay, after that, submucosa contains the muscle. Okay, so similar in this circumvallate papillae of the tongue. Okay, so in this tongue also you can see the dome shaped structure. Okay, so this is the quite of dome shaped structure. Okay, and we have the keratin in the superficial part, but in the lateral part we do not see the keratin here. Okay, so means they are non-keratinized, but they are keratinized here in the superficial part. Okay, and this is very important. Okay, I'm repeating this point for many times. Okay, you should just catch this. Okay, so it is keratinized at the superficial part but non-keratinized at the lateral part, and they contains the taste bud in the lateral part. You can see the taste bud here. Okay, so this is visual, I think. Here you can see the taste bud. Okay, also you can refer to this book. Okay, so this is a Maji Jose of manual of oral histology and oral pathology. So you can once look the picture from the book too. Okay, so this is a taste pod in the lateral portion of the taste papillae, okay, of the circumvallate papillae, and this is a foliate papillae. Okay, so it is quite a fungus like. Okay, so we can see appearance like that of the fungus. Okay, so connective tissue core is there. Okay, and there is a keratinization there present there. Okay, we can see the keratinization. Okay, so this is a filiform papillae. Okay, so this is a filiform papillae, and this particularly this papillae. Okay, so this papillae is the fungiform papillae. Okay, so now I think we have been clear with all those papillae and about the non-keratinized epithelium. Now we will meet in the next part of this oral mucous membrane, where I will try to cover this cover all the remaining topics of the oral mucous membrane and complete this chapter. Okay, so we have been discussing this chapter from long time, and now we will conclude this chapter in part 7. Okay, so this much for today. We will meet in the next part. So tata, bye bye, thank you.